If you have an excellent faculty, you will just learn a lot. It's an ideal occasion to, it's much better than reading a book or looking at somebody's presentation over the internet. You can actually interact with the speakers.
The talks have been absolutely top-notch, advanced, with the highest minded ideals are taken into account, and these are very, very avant-garde techniques that are being promoted at this particular meeting. I've also learned some things about patient management from Dr. Sykes, who gave a very insightful talk about really what this is about, which is creating happy patients. The meetings tend to focus more on technical things, but in the end, the goal is a satisfied customer or a satisfied patient who feels better about themselves. And he emphasized a lot of very interesting points in his talk that I will take home with me.
Well, first of all, when you focus on rhinoplasty, you can go into depth, details, and you can really teach well. One of the problems at some of the meetings is things are spread out so much that you can't go into detail. And so the surgeons really don't get a lot of the tidbits of information that allow them to apply it in their own practice. And so they set up the lectures here so you have 45 minutes, 30 minutes, and that's plenty of time to really get into detail.
I am very happy that I attended also the first rhinoplasty symposium in Australia, and this is a huge evolution. Many people know me, and there were many who visited my courses and attended my courses in Germany, and they really are curious what new techniques I did to make these extracorporeal septal reconstructions safer, and that it is easier also for somebody to perform it who is not as experienced as myself.
This is kind of highly specific the medical conference. This is meant for the specialist who does have some experience, and even though for the highly experienced surgeon, they can know some new thing, and they can get some new perspective. And if someone who is novice, they can get much more information. But I think this kind of meeting is beneficial for the whole level of the surgeon.
When we're able to bring the quality of what we do and elevate it, patients get better care. I think they need to get better care in terms of what we communicate with them, how we talk to them. And so I gave a talk a little bit about communicating and dealing with patients, and not seeing our work in a vacuum, but seeing our work through what they need. That's really what this is about.
We've met the best speakers in the world, and George has met a number of them. I've met a number of them. We've made friendships with them over the years, and in fact they've been really grateful to come to Australia and grateful for the invitation, but the benefit has been completely ours.